Hi, and welcome to another edition of A Few Minutes With, the podcast that showcases Illinois' College of Applied Health Sciences. I'm Vince Lara, and today I'll speak to Dr. David Strauser of our Kinesiology and Community Health department about his research on work personality and vocational behavior with the focus on people with chronic health conditions and disability. All right, speaking with Dr. David Strauser. Dr. Strauser, I appreciate you taking the time to come on with our podcast. The first question I ask when I meet with faculty is, I'm interested, I do my prep as any journalist would, and I try to find out, I wonder what led this person to our fine institution. Your background is at the University of Wisconsin-Madison, is where you got your degrees. So I wonder what led you to Illinois.
That's a good question. There's probably a variety of things that led me to the University of Illinois. I came to the University of Illinois from the University of Memphis, where I spent 10 years. And that was the first job that I got after completing my PhD at the University of Wisconsin-Madison. Down there, I started a research center, had about 30 people working for me. We were doing a lot of work across the state of Tennessee and the Southeast. And then this opportunity came available at the University of Illinois. And I think for a combination of probably family reasons, being a native Midwesterner, and also an opportunity to be at a school like Illinois, it just seemed like a nice, opportune time to make that switch from the University of Memphis to the University of Illinois, and a chance to be in a Big Ten school, at a big research school, just seemed like a hard opportunity to turn down. Also, I think Illinois is a little bit unusual compared to other programs in the Big Ten that have my area of study, that it focused a little bit more on health and health behavior, and so that was something that maybe initially didn't come into the mix, but became a point of what I really appreciated over the course of my time here.
Mm-hmm. Are you from the Midwest originally?
From Madison, Wisconsin originally. That makes sense. Yes.
Sure.
Yeah.
I know research is a big part of this job, obviously, but did you always want to teach? Was that something that was top of mind, or was it the research first for you?
That's a really good question, and I would say it's probably teaching first, research second.
Okay.
I started out as an undergraduate thinking that I would go on and do, as an athlete, I was going to go on and do coaching of some kind, and so I think that was always kind of in the, my focus as an undergraduate. And I had some very influential faculty people who pulled me aside and said, hey, what about maybe doing this? What about, looking at this opportunity? And that kind of started to pique my interest enough to go look into it a little bit deeper. After completing my undergraduate, I was out in the private sector for about a year or so and decided, this is good, but really being affiliated with the university and pursuing that academic work would really be something that I'd want to do as a career. With that, then became the teaching, and then the research kind of developed through my work as a doctoral student to really kind of look at that research. But I was very much trained from faculty at UW-Madison who trained me as a professor. Mm-hmm. So when we talk about a professor, in my opinion, it's the research, teaching, and service together. Yeah. It's not just one aspect of it. So that kind of relates to your first question about being at Illinois. I think Illinois gives me an opportunity to do all three of those core components of being a professor, and that's teaching, research, and service.
Mm-hmm. Focusing on the research part, now your research to an extent focuses on work, health, and well-being. And I'm wondering, commonly with researchers, there's something that inspired them to look at that. And I was wondering if there's anything that inspired you to look at those research lines.
That's kind of an interesting story, probably, as reflecting back on it. Again, as I was an athlete in college and struggled with injuries in college, it became losing the opportunity to compete in college because of injuries. Mm-hmm. I guess that was happening at the same time that I had some of these influential faculty in my ear talking about, hey, what about pursuing rehabilitation psychology as a career? What about some of those things? So kind of, I guess, serendipity of kind of those things coming together. That extended then to probably my first job, as I mentioned, before I went back to graduate school, and that was working with injured workers in Southern California. Mm-hmm. And through that, my own experience of injury and then working with industrial injured workers kind of solidified my interest into working with people with disabilities as a whole, and working with people who are having problems working pursuing their careers because they have an injury or illness.
Yeah, some of your research looks at marginalized workers. Could you talk a little bit about that?
Yeah, I think that's a pretty big term, marginalized workers. And it's a good word. It's an encompassing word. I look at, especially right now for probably about the last 15 years, I've really looked at young adults who are having a hard time entering the labor market for some reason related to a chronic health condition.
Okay.
Whether that's cancer, I do a large group of that, could be some mental health issues, autism. So they've been marginalized because they have a chronic health condition. Mm-hmm. We have a project right now where we're looking at foster care youth, formerly incarcerated or justice-involved youth. So you're correct to say my work has always kind of looked at people who've been marginalized from entry or participation in the labor market, usually because of some chronic health condition or combination thereof. So my research has focused a lot on younger adults in terms of their entrance into the labor market. Probably an advocacy side of me has continued to deal with industrial injured workers. I'll use that term, people who've been injured on the job, and advocating for their overall well-being and helping them manage and deal with their loss. So that's probably more of a outreach service component of it than it is a research part, where my research is primarily focusing on these young adults' entrance into the labor market.
So what particularly do you deal with? Is it that trying to overcome the stigma of what these workers have dealt with?
Most people who have chronic health conditions are likely to experience difficulty in meeting the demands of work and how it's typically performed.
Okay.
So they're having some issue with meeting the job requirements or figuring out how they identify with the labor market. They may, for example, somebody might have an interest in doing something as a career, but because they have a limitation or functional impairment can't pursue that, so that causes a lot of stress. So I deal with that. There also is just a lot of people right now, and a lot that we more to learn about mental health, that they're having a lot of mental health issues that are impacting their ability to function on the job and meet the demands on the job. So they might get a job, but then can't keep a job. And so after a period of time, they start to develop that resume that looks very scattered, very thin in terms of duration on the job, and that becomes then stigmatizing and marginalized. So stigma is an issue, obviously, that everybody deals with chronic health conditions, but that is something I deal with. But I'm more interested in how they fit to the environment. How do they see themselves fitting as a worker, and how do they develop their identity as a worker?
Has your research ever led to you being a consultant for either a company or perhaps an industry looking to help these marginalized workers get back in?
I do a lot of work with a group called Children's Brain Tumor Foundation, where I work a lot with them to help young adult cancer survivors, and businesses kind of help understand issues related to cancer survivors, try to help that fit. So yes, I've worked with some nonprofits and some NGOs to kind of work with them to understand, develop plans, develop programs to help them address these issues.
You know, you developed what's called the Illinois Work and Well-Being Model. I'm interested about that. Tell me a little bit what that is.
Yeah, the Illinois Work and Well-Being Model is kind of a byproduct of my 30 years of in this field, of kind of how I was thinking about career stuff, and finally came together for me as a model where in our field, in the health field, we use a lot of the International Classification of Functioning, or the ICF. So I use components of the ICF and then common career development domains and kind of mesh those two together. And the model really tries to explain about how people's functioning and how their personal environmental factors impact how they function, and how their functioning impacts the career domains of how people become aware of what they are in terms of what they want to do, their vocational identity, how they go about acquiring jobs, and how they go about maintaining jobs. And so that model kind of helps provide a framework for research, and it's guided a lot of my research over my whole career. Probably the last 4 or 5 years it's been formalized as a model that we're using to guide our research, to help us identify factors and variables. But also we've been using it quite a bit with practitioners to help them guide their services to identify where interventions might need to be placed, where are points of intervention. So as an example, if we're having a young adult cancer survivor who has a brain tumor, they're trying to figure out, where do I fit into the world of work? What am I going to do? How am I going to do it? We might want to look at their functioning. What are the residual factors of their brain tumor? How do they function in terms of physically, cognitively, emotionally, and how do they communicate? And look at that. However, even though as we look at those factors or those components, we also understand that personal factors, psychological factors such as resilience, hope, self-efficacy impact how they perceive their functioning. In addition, environmental factors, ethnicity, social class. I say ethnicity is a personal factor, but their cultural background, their social factors, their schooling, their family also impact how they perceive their functioning. So we want to kind of make sure that we're looking at all those factors, and then how do they relate over to the career domain, and those three factors that I talked about in terms of awareness. We call it awareness, basically vocational identity, acquisition, and maintenance.
You always have research going on, right? Several projects in the pipeline. It's one of the things you have to do.
Right.
What are some of the ones that you have that you're excited about, that you can talk about, let's say?
Yeah. We actually have a lot of good stuff going on right now, and I'm very excited about it. We're at a good time. We're having a lot of data and a lot of projects. So we are right now, a couple things. In terms of the cancer group, we have several data sets right now, one with Dana-Farber, one with Children's Brain Tumor Foundation, where we're looking at these psychological and career factors that impact employment and employment outcomes with a group of brain tumor survivors. What's really exciting about that, and this might compare to like people in other areas like epidemiology or even breast cancer, our data set combined right now is we have about 300 brain tumor survivors. That's quite a good number for brain tumor survivors. So that's a hard group to get. So we have some data there that we're starting to analyze and look at, working with these Dana-Farber and Children's Brain Tumor Foundation to kind of look at what are these factors that impact employment outcomes, and we're very excited about that. We have several papers submitted right now that are under review, a couple of papers that have been accepted that are looking at using the Illinois models we talked about, looking at how functioning and perception of functioning impacts the different domains of career. Highlight to that would be we're starting to get good evidence to suggest that how people emotional functioning, the perceptions of their emotional functioning really impact a lot of their identity development, contribute some to the acquisition phase. Conversely, we know that people now who start to, how they perceive themselves physically really has a lot to do with how they perceive their ability to maintain a job. So what we can start to do there is kind of start to parse out of where people are in their career development, what our interventions need to target, and what areas of functioning do we need to maybe support or address to maximize outcomes. So that's very exciting with that. Another population that we're starting to look at, or another group that we're working with, is, as I mentioned, a broader group of people with disabilities, looking at developing some instruments related to the Illinois Work and Wellbeing Model. We have a couple instruments being developed right now to help measure some of those constructs within the model, so we're very excited about that. That's not as maybe exciting, but for us that's a very practical piece. Another area that we're really starting to get into, because we have seen it quite a bit with the young adults in foster care and the young adults in formerly incarcerated young adults, is the issue of trauma and how trauma is impacting them, but how trauma is impacting their career perceptions of their career development and their career development opportunities. And not surprisingly, we're finding again there's quite a bit of an impact there in terms of how much trauma, how they're experiencing that trauma, how they feel about that trauma, how close to the surface, so to speak, that trauma is going to be impacting a lot of how they see themselves as a worker, their identity, and their motivation to pursue those things.
My thanks to David Strauser. For more podcasts on Illinois College of Applied Health Sciences, search A Few Minutes With on iTunes, Spotify, iHeartRadio, Stitcher, and other places you get your podcast fix. Thanks for listening, and see you next time.